This video will guide you through the process of issuing a bowel kit to eligible patients during a consultation through the NCSR Hub. Through the Alternative Access to Kits model, healthcare providers can use the NCSR Healthcare Provider Portal to bulk order free bowel cancer screening test kits, also known as IFOBT kits, and issue them to eligible patients during an appointment, which you can record using the NCSR Hub and issue a participant details form for your patient to complete and include with their samples. Talking with a healthcare provider can be key in helping people decide to do the bowel screening test and could help increase low screening rates in some community groups. You've had a chat with your patient about completing the bowel cancer screening test and will be giving them a kit to take home. It's important to complete a few key steps to ensure the samples can be tested and the results sent to the correct address. First, check that your patient is eligible for the bowel screening program and hasn't screened in the last 2 years, and that their contact details are correct and make any necessary changes. Then, complete the bowel kit issued by healthcare provider form to generate a unique pre-populated participant details form. Then, print a copy of the participant details form and give it to the patient to sign and include with their samples in the reply paid envelope, which is enclosed in the kit. When you search for your patient and the NCSR Hub is displaying their screening information, confirm your patient's details are correct and, if necessary, make any changes. Under the Submit Forms and Reports section, select the Bowel Kit Issued by Healthcare Provider form. Please note, this form will only display if your patient hasn't screened in the last 2 years and is eligible to receive a kit. Next, select a reason for issuing the kit. The system identifies by postcode whether the participant lives in a region where the average monthly temperature is currently over 30 degrees Celsius. Samples need to be kept cool for as long as possible, and exposure to high heat can affect test results. It's recommended to issue the test kit to patients during cooler months, but this can be a judgment call by the issuing healthcare provider if they see a clinical benefit. Enter the date you issued the kit and its expiry, found on the back of the kit. The nominated healthcare provider will receive a copy of your patient's results. If a provider is already recorded against the patient's NCSR record, their details will display here. Otherwise, the details of the healthcare provider filling in the form will display. Use the provider lookup if you'd like to nominate a different healthcare provider. Then provide confirmation that your patient has given consent to receive this kit from you. Next, submit the form. This will generate a pre-populated participant details form which will display under the NCSR history section for you to print and give to your patient with the kit. Ensure you remind them to enter the dates the samples were taken, sign the form, and include it in the prepaid envelope when they send back their samples. After you've submitted the form, an icon will display on the patient's bowel record. This will inform other healthcare providers that this person has received a kit via the Alternative Access to Kits model for this screening round. To assist you with patient follow-up, check your patient's NCSR history to see if a recent test result is displaying or is inconclusive. If you don't see a result, it's a prompt for you to get in touch with your patient and encourage them to either return the completed test kit or complete a new test kit. To find out more about the National Bowel Cancer Screening Program and Alternative Access to Kits model, visit health.gov.au/NBCSP.